a lot
Yes,
to us, but you can also go ahead and pray.
yes.
Please pray for us to begin the meeting.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Okay, if you are done, then we say Amen. So thank you very much, Said, for the word of prayer. At this point, I want to welcome Dr. Maureen Kimani, Head, Division of Community Health, to give us introductory remarks. Then also bring to us our peers to make official remarks for this assembly. Dr. Maureen, please proceed.
Good evening, and thank you everyone for joining once again. We are very excited to have our fifth Community Health Assembly today. This is an initiative of Madam PS, who has really pushed us to ensure that we do these meetings. We are very happy that we've been able to get CHPs across the country joining the meetings, be able to get information on what we are doing to support community health program across the country, and also hearing from our peers. I know she promised that she'd be awarding in the last few assemblies. We've not been able to award anybody, but I'm happy to announce that today, later in the program, we have a clear winner who has visited most people last week. Remember, this is a weekly award that we give. So today, Madam PS, I'm happy to announce that we shall have the top CHP for last week, and I think this will give more motivation to the other CHPs to do their job. I'm excited to see that we are joining. Please call all your CHPs in your unit. If you can't see them on this call them. Let us join as many people as possible. So I want to thank you, everybody. And as has been stated, today we are focusing on eCHIS. We all know eCHIS is the tool that we all use to take care of our households. It is the only way we know that CHPs are working. We can tell who is working, who is not working, based on the information you submit once you visit the households. So today we saw in the previous assemblies, we had a lot of questions around eCHIS, how it's supposed to work, and so forth. And so we are really looking forward to answering those questions, hearing from you, knowing where are the bottlenecks and how we can even make it better so that you can continue to serve Wanjiko, all Kenyans, wherever they are, and they can really feel the government programs get into their homes. Remember, in community, we say we are leaving no one behind. The people with disability, the vulnerable populations, the children, the women, the men, everybody, the elderly, everybody is taken care of by our CHPs. So we really want to thank each one of you for joining, and I can see we are joining in very high numbers. Please continue joining, and we really want to appreciate your efforts and the time. We don't take it for granted that you make time to come and just be with our peers and the other and her technical team, just to know how better we can be able to serve the Kenyans wherever we are. So I thank you everyone for joining. We'll have a team from the ministry who will be responding to some of those questions, but do not feel that you cannot ask more questions. Please ask any other question you feel that has not been responded to. Please ask it during this time so that we can capture it and also be able to respond. Hopefully today, if not today, we shall make sure that all your questions are answered, and we are working to the best of our abilities to make your work as a CHP even more easier so that you're able to serve your people better. Without much ado, I want us to welcome our peers to give us opening remarks. PS, as I said, today is a happy day for us because we have a clear winner, and I think this will be the trend. We have cracked the nut where things were not working so well. We've been able to come up with a clear winner, and we are looking at who has visited most people. We're not just looking at the visits you made. We are looking at, did you assess a pregnant woman? Did you assess a child? Did you screen a man for hypertension? Did you screen a woman? Did you attend to an elderly person? So we are looking at all those parameters and not just that you assessed a household. So if you went to a household and you only did wash, you only looked at whether they had a toilet, you did not assess anyone. So there, we really were able to remove such kind of household visits and only ensure the people who are able to give key messages to all the populations are the ones we are taking care of. So thank you very much. And now let's show some love and claps, e-claps, as we welcome our peers to just open this assembly, which is her pet baby, and then we shall proceed with the Q&A session. Karibu sana, Madam PS.
Thank you very much, Maureen. Na CHPs wenzangu, habari yenu, habari ya jioni. I'm very excited that this CHP assembly just kicked off and we are doing really, really well. I am sure this being the 6th, is it the 6th?
Yes, madam.
Yes, being the 6th assembly, we are getting better and better every day. And since we included issues to do with thematic areas, when we come, we want to talk about issues, and then we are able to also answer your questions in good time. But the most important and the most exciting is the CHP award of the week that we must be giving at least one person in a week. And of course, we will extend it to the CHA and extend the same to the unit. Maybe in a month, we want to know which unit has done really, really well. I can see Jackie Chapto, you're really waiting for the award. Put in effort, put in effort. Wekelea nguvu na sisi tutawekelea jiwe. So today's assembly is an opportunity to listen directly from you people who are at the center of delivering the community, the primary health care at the household level. So through eCHIS, you are not only providing services, but you're also generating critical data. Let me explain to you exactly what you do when you use eCHIS. When you take data, it comes to my office, or that data, I'm able to utilize it to plan for tomorrow. I'm able to know how many people have diabetes in this particular area. That primary healthcare network, they can be able to plan for the people within that particular area equally. And we are also able to know the disease patterns in our country and at the community level. So I want to encourage you that it is not just about digitization. It's not just about going to the household and recording, but that information is very, very critical. We began this by laying the foundation through putting in place-relevant policies. We did guidelines, designed and developed eCHIS system, piloted and refined, and successfully scaled it to 47 counties. So today, our focus is on strengthening the system, improving performance and usability, integration, so that we deliver real impact at the household. We want to hear your experiences. Of course, sahi nimeshaanza kutuma message whitelisting. Wi-Fi, data, nimeanza kutumiwa na nimeona. So practically, we want to hear from you. What is the feedback from the ground? And what is your expectation? As CHP at the community level, you are very, very critical that eCHIS is implemented effectively. You're responsible for capturing accurate data. So usiende useme kwa sababu kuna zawadi, wacha niseme niliona watu fulani, nikaona wawili wa diabetes, nikaona wawili wa blood pressure. Usiongeze ile data yenye haiko accurate. We trust you, we value you, and we see that you are the real person on the ground. I can see a lot of information coming in, but somebody is going to capture it, so don't worry. Yes, one has distracted me because they are saying they were told that CHPs will be included in the SHA cover. Indeed, yes. And that question, I have answered it every other week. Even next week, I will answer it. That yes, you're going to be in the cover starting from the financial year 2026-2027. Now, this assembly is meant to be an open and respectful place. We encourage honesty. We want to encourage reflections. We want to encourage the experiences that you have come. Don't think that somebody is spying on you. Please let us talk so that we can make our program even better. So your insights will be highlighted and we will make progress together. Thank you very much. Let me take back the mic to Maureen so that you can continue with the program.
Asante sana, madam. More claps for our peers.
Or you wanted me to announce anything?
I will give you the I've sent you something, but I'll give you the announcement time after we do the Q&A. Asante sana, but please, you're welcome to continue so that you hear the Q&A session. So asante sana, Madam PS, we really appreciate your presence. So next, asante. So next, we're going to go to the session for the Q&A, where our technical teams will be reading out some of the questions the CHPs have been asking since we began this assemblies. We had lots and lots of questions on eCHIS that CHPs have been asking about. This is their main tool for visiting households. It's the only way we know that they're visiting households. So they've had a lot of questions, and that means that they're actually using it, because we can see that they're asking questions. You can only ask about something that you know about. So we are very happy that all of you are using eCHIS to visit households, and we'll be getting feedback on some or responses on some of the questions you have been asking. So to take us through this session, we have my colleague from the Division of Community Health, John Wanyungu, who also is in charge of eCHIS matters and at the division. He will be joined by our ICT Karim, who works behind the scenes to make sure that eCHIS is working at all times. When you're having an issue, it is not working, the person who ensures that he fixes all our bugs. So we really appreciate our ICT officer, Karim Kanji. And we also have one of our partners from Medic, who also helps a lot, helps Karim and helps the ICT a lot in the process of ensuring that eCHIS is always working very well. So, and that is Philip. So I'd like to take this opportunity over to you, John. I'm sure you have all the questions. So please be able to ask those questions, and what the team members, Karim and Philip, will be able to support. The responding, and please use a language. You can use Swahili or any language that is simple so that the CHPs are able to do a better job moving forward. Asanteni sana and have a good session. Over to you, John.
Okay, thank you very much, Dr. Maureen. So we are going to get to the session of questions and answers, focusing on eCHIS. So, Anna, are you able to project the questions?
Not really, John. Please just read. Read from your text, and because Karim and
okay, that's fine.
Already have them. Yeah, proceed.
So the first question is around household registration. And the specific questions here are, how do we register households when the app is slow or sometimes hanging? And why does the system fail when saving a household that has been registered? It doesn't save the household which is already registered. And the third question, Karim, is can we edit a household details after submission? And finally, what happens if we enter wrong patient details? Or when we enter wrong details, is there room to edit? So Karim, please take up that.
Okay. Good afternoon, everyone. So I think I can answer the questions on, I hope you can hear me, on how to register the household when the app is slow. So eCHIS primarily works offline, meaning that it shouldn't really affect how you register households. As long as you have at least synced your application, it should be really easy to register the household and should not really affect how the household is working. There have been system improvements that we have been doing just to ensure that there is also stability during registration. I think there has been issues around how registrations have been happening, but we are continually improving the system to enhance it to be more stable. On the issue of editing the households, so we are still strengthening some of the editing and validation features, and also trying to do as much as possible on the user training, so that these some of the errors that happen when editing the household, and when you enter the wrong patient data can be avoided altogether. So when it comes to editing the household, it's actually very simple. So there is at the top of the application, there are three kind of dots at the top right. You can press them and you'll see edit, which will now allow you to edit the details of a household after submission. So if you enter the wrong details, you're able to edit them.
Zile machine zozote zinatakikana zita.
Madam PS.
I hope that answers the question.
Madam PS, you are making a point.
Please. Yes, please.
You are making a point, but you weren't very clear. If you can come again. Yes.
Which point?
You were speaking, you interjected Karim when Karim was explaining about editing.
No, sorry. It was...
Oh, it was a mistake, okay. Fine. All right, so Karim, please, if you can finish up with that question of editing. You are saying there are three dots at the top right-hand corner of the application. When you open your phone, you're on eCHIS, at the top right-hand corner, there are three dots. When you press those three dots, it brings up an option for editing. So when you press that, then you can go into a particular record na uweze kufanya mabadiliko kama uliingiza wrong data. Hiyo ni sawa, tumeelewana hapo? All right, then there was a second question on eCHIS around reporting and syncing data. So, Philip, specific question is, why is my data not reflecting in CHIS? CHIS is our MOH reporting platform. Then how long should syncing take? And finally, what should we do if data fails to sync completely? Philip, you can take that.
Yes, I hope you can hear me.
No, you are muted maybe.
No, I have unmute. I hope you can hear me.
Yes, now we hear you and we also see you.
Okay, asanteni sana. So the first question, swali la kwanza ni kuwa kwa nini my data yangu haiwezionekana KHIS? Nafikiri kuna kazi imekuwa ikiendelea kwa mwaka huu kuhakikisha kuwa CHPs wanapofanya kazi nyumbani inaonekana kwa supervisor na mwishowe kwa KHIS. Kuanzia mwezi wa 3 ndio tumefanya hiyo system ikaenda live, na tunafikiri by now CHAS wanafaa kuwa wakiconfirm kuwa wanaona ile data, na in case kuna cha yeyote data yake haionekani, tumesha devise how the community health coordinators that CHAS can reach out and then we'll check specific records kujua kwa nini data yao haifiki. Na njoo pia kuna kazi inaendelea kuhakikisha kuwa all the data elements zinafaa kuwa zikiingiza katika KHIS zimekuwa reviewed ndio mwishowe zikuwe included kwa KHIS. La pili lilikuwa kwa nini syncing inachukua muda. Wakati CHP anapopatiana services nyumbani, wengi wao kumbuka wanafanya kazi mahali pasipo na connectivity, na kwa hivyo unaweza pata katikati ya masaa 6 data yako huwa imeshafika kwa system, na ndio mwishowe tuweze kuona report zako. Lakini ukishaingia kwa app yako pale kwa reports, utaweza kuona kama data imefika kwa system. Kwa hivyo inaweza kuwa shida mahali huko hakuna connectivity, kwa hivyo data yako itachukua muda kidogo kufika, lakini uzuri ni kuwa immediately ukiangalia kwa reports utapata hakikisho kuwa data yako haijapotea, na utakapopata connectivity ile data itaweza kufikia server na cha wako ataweza kuona kwa kweli umekuwa ukifanya kazi. In case upate data yako haijasync, ni vizuri kuwasiliana na cha mwenye ataendelea kujulisha sub county focal person, na hiyo report itatufikia. Tutaweza kuangalia kama kwamba either mahali unafanyia kazi bado shida ni connectivity, ama kuna jambo lolote lingine linaweza kuwa linafanyika. But uzuri ni kuwa data yote, kazi yote unayofanya ni gumu kuipoteza kwa njia yoyote. Maybe lile jambo nitataka kusihi wana CHPs ni kuwa ukiona haujaweza kusync, tafadhali, kama vile nimekuwa nikisema mara mingi, usitoe hiyo system, hiyo app ya eCHIS kwa simu yako, kwa sababu unapotoa, kumbuka kuwa data kwanza inakaa kwa device yako, na kizu uninstall ile app, it means ile kazi yote umekuwa ukifanya itapotea. Kwa hivyo cha msingi tuendelee kufanya kazi, na in case tutakuwa na shida ya kusync, wasiliana na cha, ataweza kuwasiliana na wengine wetu. Kuna WhatsApp group yenye tunawasupport, na tutaweza kuangalia kwa kweli ni nini kinafanyika, lakini tafadhali tusiuninstall hiyo app yetu kwa simu, kwa sababu hapo ndio kwanza data inakuwa stored, ndio mwisho connectivity ikipatikana hiyo data ikuwe push to the servers. Asanteni.
Asante sana Philip kwa hayo maelezo. So tumeambiwa kwamba data huwa haipotei so long as ufanye data yako na umesubmit na pia umesync, itakaa kwa simu yako hadi ufike mahali kuna network. Unapata network itaenda kwa servers, kwa hivyo data huwa haipotei. Swali lingine ni Na jambo lingine ambalo tumeambiwa ni kwamba kama unaona uko na ugumu na simu yako na eCHIS, ujulisha cha wako mara moja. Sababu yeye wako na simu zetu, wataweza piga simu kwa sub county, kwa county hadi kwetu, ili tuende kwa system tuangalie, tuone mahali shida iko, then we see how we can assist you out of your situation. So swali lingine ni maada ya kufanya reporting, around reporting and syncing again. Karim, do you understand by can you continue working when there is no network? Nafikiri Philip amejibu, amesema ndio, tuna simu zetu, system yetu ni offline. Kwa hiyo endelea kufanya kazi hata kama hakuna network mahali huko, kwa sababu utakapofika mahali kuna network, data yako itasukumwa kwa server and will later be lost if the phone goes off before syncing. Will later be lost. Philip amesema kwamba data si rahisi ipotee, itakaa kwa simu yako, na utakapofika mahali kuna network itakuwa moved kutoka kwa simu yako iende kwa server. Swali lingine ni kuhusu referrals. So swali ni kwamba how do we initiate a referral in eCHIS? Why are referrals not showing at the facility, and how do we confirm a referral was completed? Haya ni maswali mazuri sana kuhusu referral, kwa sababu tuna refer watu kutoka kwa households wenye wako na shida ya kiafya, kisha wafanyia assessment, tunawatuma kwa hospitali. So jinsi ya kuinitiate referral ni kwamba iko guided by the system. eCHIS ina guide wakati ya kurefer. Kwa mfano tunapo assess mtu na kwa ugonjwa wa pressure, kwa mfano unapoandika readings zile umepata wakati umepima mtu pressure ama sukari, unapoandika kwa eCHIS ile namba umepata ulipofanya assessment, system itaona hizo namba kama ziko juu na ikuambia refer. So referral inakuinitiate na system, inakuambia refer na una refer kulingana na vile system imekuambia urefer. Na unapo refer, kulikuwa na swali kama utaendelea kutumia MH100 kufanya referral. Jibu ni ndio, kwa sababu referral zetu za eCHIS bado hasionekani kwa hospitali, kwa sababu hospitali nyingi hazijawekwa system ya kusoma referral yako kutoka eCHIS. So ingawaje unafanya refer kwa eCHIS, inabidi pia uandike MH100 ile referral form ambayo inachukua particulars za mgonjwa, ile shida ambayo, ile sababu ambayo imefanya umrefer, aende nayo hospitali. Anapoenda nayo hospitali anachukuliwa na anahudumiwa zaidi. So kulikuwa na swali, do we still need to fill MH100? Nimesema ndio, tunatumia MH100 especially kwa sababu kwa hospitali zetu hatujaweka system ile ya digital yenye ina communicate na eCHIS, ili unaposema referral kwa eCHIS inaonekana kwa hospitali. Hatujafika hapo bado. So ingawa sisi tuko tayari kwa community na referral digitally, lakini hospitali zetu nyingi hazijakuwa na system ya kupokea hizo referrals digitally. So inabidi tena tujaze MH100 manually, ndio mgonjwa aende nayo hospitali apokelewe na asaidike. Why are facilities not recognizing e-referrals? Ya hili swali kwamba mnapofanya referral kutoka community, mgonjwa anapofika hospitali, wewe mdaktari hospitali recognize your referral. Hilo ni jambo ambalo tumekuwa tukijaribu kushughulikia through communication na our counterparts hospitali, ili waheshimu referral kutoka kwa CHP, wanapoiona wachukulie kama referral nyingine yoyote na wahudumie huyo mgonjwa ambaye amekuwa referred na CHP. So tumekuwa na comment kwamba mnapofanya referral CHPs kwa hospitali, mgonjwa anapofika hospitali, referral yako ni kama it doesn't matter, lakini jambo ambalo lazidi kucommunicate na wenzetu hospitali ili waanze kuheshimu referral za CHP wanapopata wagonjwa wametumwa na CHP hospitali. Kuna area nyingine ya devices. Kuna swali ya devices ya simu. Swali kwamba will CHPs be given new phones? Karim, and what happens if a phone is lost or stolen? We can respond to questions around replacement of phones, whether CHPs will be given new phones. Karim, do you want to go on that?
Okay. Asante
Yeah.
Nyongo, naweza jibu maswali hayo na tutumie Kiswahili.
You can mix
Sim
Swahili, English. Even mother tongue is acceptable.
Kwa sasa kuna mkataba unaowekwa pamoja na counties ili kusaidia kuangalia mambo ya simu. Simu kuwa zina shida, hazifanyi, maybe tunasema zingine ziko very slow ama hazifanyi kazi. Kuna mkataba unaotengenezwa na counties kusaidia issue ya kureplace na kuangalia simu inapoibiwa ili tuweze kureplace for the CHPs wenye wamepoteza simu ama simu yao inasumbua ama tuseme inafanya kazi polepole ama ifanyi kazi inavyostahili. So hiyo ni kitu inayoendelea na ni bado jambo linaloangaliwa pamoja na counties. Yeah.
Okay, so tumeelezewa mambo na simu. Ndio, kuna mpango wa kurenew phones na our PS is very particular about that, kwa sababu tumepata complaint kuwa simu ambazo tuliwapatia 3 years ago zimefanya kazi na ni kama muda wake umepungua wa kufanya kazi vizuri, so nyingi zina hang. Haswa wakati mtu ako kwa nyumba anaendelea kufanya assessment na simu ina hang, labda kwa sababu ya battery ama simu yenyewe muda wake maisha yake imekuwa mafupi. So kuna mpango wa kuna pia CHPs ambao hawakupata simu, hiyo mnajua. So kuna mpango ya serikali imenunua simu za kupatia wale CHPs ambao walikosa simu raundi ya kwanza, na wale ambao kuna simu zenye ziko na shida. PS ameambia counties kwamba waandike hizo report za hizo simu, waseme CHP fulani simu yake iko na shida fulani. Hiyo report kutoka kwa county ikuje kwetu, itaangaliwa na PS atakuwa able to respond to it. So tunangojea report kutoka kwa counties in regard to specific issues with specific phones with specific CHPs, ili tusigeneralize tu kwamba simu zina hang ama ziko na cracks. Tupate report ya kila simu yenye iko kwa mikono ya kila CHP na ile shida iko na hiyo simu, ili ishughulikiwe kulingana na ile report ambayo tumepata kirasmi kutoka kwa county. So hiyo ndio report ambayo tunangojea, tukipata tutarespond accordingly. The other area of concern other than simu ilikuwa mahali ya supervision. Na swali ni, why can supervisors not see CHP reports in eCHIS? Philip? And how will CHAS monitor performance if data goes directly to KHIS? Yeah, because we need to view your data, CHPs, for us to use that to supervise you and also to monitor your performance. Philip, you can respond to that?
Yeah, ndio Bwana Wanyungu. Ndio tumepokea ripoti kuwa kuna CHAS hawawezi ona reports za CHPs na tumekuwa tukichukua yale majina na kutaka kujua kwa sababu kuna ile feature ya CHP performance. Kuna mabadiliko kidogo tulikuwa tumefanya tukijaribu kuona zile counties zinafanya performance for pay, but kuanzia mwezi wa 4 tutakuwa release feature itakayowezesha CHAS kuweza kuona reports. Adhiki la msingi lenye naweza sema hapa ni kuwa kuna kazi inaendelea. Tulikubaliana na county coordinators that by the end of this month wale CHAS wana oversee more than one CHU watakuwa wameshirikiana na coordinators wa county kuhakikisha kuwa wamepewa credential moja itakayowasaidia kulogin kwa app na wataweza kuona CHU zao zote, na hilo litatukubalisha kuwa kuanzia mwezi wa 4 tutakuwa tuna release feature ingine ambayo zile credentials wako nazo watakuwa wanapata access ya superset, kwa sababu tunataka waanze kuona more supervision data related across the various health areas they supervise, na kwa hivyo hiyo data watakuwa naona na wanaweza download data ile data wakaweza kuona per CHP kuanzia registration, assessments all the way. Watakuwa pia wanaweza kuona jinsi CHPs wanavyo sync, ndio wakati wanaenda kuwatembelea kwa ile monthly meeting already chat atakuwa na data ataweza kushare na CHPs na atakuwa ameweza kujua ni CHP mgani haja sync by the time wanakutana. Hilo litasaidia ku make sure data kazi ikishafanyika ile data inaenda kwa server mapema na kurahisisha system inakuwa haijalemewa, kwa sababu ndio tunafanya kazi na ile data ni mingi, na tukigoja mwezi wa dakika za mwisho wa mwezi kusukuma ile data, unapata hiyo ndio ina affect system performance. Kwa hivyo mazuri yanakuja, tumewasikia, na pia tutakuwa pia tunakuja mashinani kujua kama kuna changamoto zingine walizo nazo, tukiendelea ku enhance the system. Asanteni.
Asante sana Philip. So swala lingine ni kuhusu, bado tuko under supervision. Nauliza iwapo cha anaweza edit data yenye CHP amecapture akaweka kwa eCHIS, na hiyo tunasema kwamba hiyo haiwezekani kwa sababu data, wakati CHP amecapture data na kisha submit na kusync, inaenda to the servers, so haina nafasi ya cha kuedit ama kubadilisha anything, inabaki hivyo, na tunajua ni CHP gani ame collect data gani wakati gani, na who is responsible for approving the reports. So report zako mwenye ako na responsibility ya kuapprove ni supervisor wako ambaye ni cha, ndiye ataangalia report zako na aziapprove, lakini ile hawezi fanya ni kuedit, na hawezi kuleta ama kuvalidate your data as is in the system. Kuna maswali kadhaa, naambiwa muda wetu umeenda. Timu eCHIS tuko na dakika 5 pekee zimebaki, so kama tutatamaza maswali zote, labda tutarukisha moja iende meeting nyingine. Kuna swali around data quality and validation. How do you correct mistakes after submission? Tuliambiwa kwamba kuna 3 dots pale juu ya simu yako yenye ukifinya itakukubalia kufanya editing. So kama umecapture data wrongly, wewe umesema huyu mtu ni mwanaume wakati ni mwanamke, unaweza wakati huo kuingia hapo urekebishe, umpatie the right gender. So kuna provision ya wewe kuedit kazi yako as a CHP. Na kuna swali la user support and training. Will there be refresher training? Hii ni swali mzuri sana on eCHIS. Who do you conduct when the system fails? Yaani maswali mawili. So refresher training kwa eCHIS iko, tuko na hiyo mpango na imeendelea kwa counties tofauti tofauti, kwa sababu inaenda pia na availability ya resources. Wakati tuko na hela za kufanya refresher training, na kaunti zingine zimejifanyia their own refresher training, wanaitisha technical support kutoka kwetu, na tunawatumia walimu wanakuja wanasaidia ku train counties kama Kwale wamefanya hivyo na wengine. So refresher training inakubalika na encourage refresher training either by counties or counties working with the partners and also national government. So who do we conduct when the system fails? Tumesema ni supervisor wako ambaye ni cha, ndio unamwambia simu yangu imehang, I submit na mambo kama hayo. So kama kuna shida na simu yako ama system yako, una conduct your supervisor ambaye ni cha. Then swali lingine ni kuhusu workflows and targets. Inauliza kwamba how are we expected to meet targets and still use eCHIS? Does eCHIS increase workload? eCHIS haiongezi workload, if anything inaleta efficiency kwa kazi yenu, kwa sababu sasa mnatumia system ambayo ina guide jinsi ya kufanya assessment. Sasa kwetu tunaona kama haiongezi kazi, badala ya kuongeza kazi inalete efficiency kwa jinsi mnavyofanya kazi yenu, na inaleta pia quality, mnafanya kazi kwa njia mzuri kutumia eCHIS. Kuna swali inauliza, can the ministry provide us with power banks to support us in our work in hard to reach areas with limited Safaricom network connectivity? Power bank ni storage ya power, na hii ni swali mzuri sana. Hii ni jambo ambayo tumearifiwa na tunalifikiria, na tukiwa nafasi ya kuwa na resources ambayo inaweza nunua power bank ya iende na kila simu, tutafanya hivyo. But maybe we'll consult further on this. These are request that has been with us for a long time. Provision of power bank to accompany every phone, especially in counties where power supply is not well saturated. Hilo jambo ambalo tutaongea huko kwa national level, pamoja na PS wetu tuone jinsi inaweza respond. So hili yalikuwa maswali yetu for this meeting on eCHIS. Tutaachia hapo na I invite Dr. Maureen atupatie report ya performance. Dr. Maureen, please.
Thank you very much, John. Some claps, show some love to John and the team. I'm sure these are questions that zimekuwa zikisumbua CHPs across the country because zimekuwa zikiulizwa kutoka tuanze hizi assembly, na natumaini ya kwamba leo venye mmepata majibu, wale chairs wameuliza majibu na CHPs pia, at least sasa maneno yenu itaendelea vizuri. Najua bado kuna zile changamoto, lakini kama mnapoviona tuko na the highest commitment from our boss, our accounting officer, Madam PS, na anasikiza haya maneno yote yenye mnauliza, na pia zile changamoto, na I'm sure tutapata a way forward so that your work can be easy. So bila kuchukua muda, in the next 5 minutes nitakuwa nasoma ile report. Mnakumbuka ya kwamba our PS Mary Muthoni requested that on a weekly basis we identify the CHP who has done most work. That means wameenda kwa manyumba, wameangalia wale wa Kenya wako kwa hizo manyumba, wamewapea zile key information, wamewafanyia assessment, wamewafanyia screening, wamefanya referrals, na tukiendelea hivi tunaona kwamba watu wengi sana wataweza kupata zile benefits za services za community health. Kama mnapovyojua, community health ni foundation ya health system, na tukiwa na msingi bora, hata afya ya Wakenya itakuwa bora zaidi, because watu wengi watakuwa na ile information ya kuhusu magonjwa tofauti, ya kuhusu kujikinga na magonjwa, ya kuhusu kutembelea hospitali mapema, wasingojee mpaka ugonjwa imezidi sana. Na tunaona ya kwamba tukiendelea hivyo hata reduce zile indicators mbaya zenye zinatufuata kwa wakati huu, kama kina mama wanajifungua manyumbani ama wanaenda hospitalini wakiwa wamechelewa sana, na saa zingine hata mama ama mtoto anapoteza maisha. So the community health program is supposed to support some of those things. So without taking a lot of time, nitaenda kwenye report ya last week. So Madam PS, we have prepared a report on how the CHPs performed from Monday last week up to Sunday, yesterday. And I really want to first congratulate the CHPs. I have seen that there has been improved activity of the CHPs. Last week alone, we had 42,311 active CHPs. 42,311 active CHPs. And these CHPs were able to serve 989,480,000 Kenyans. Those are unique people who were able to be seen by a CHP last week. That is a very, very big achievement. And I'm happy that now we're ensuring that Afya Bora Mashinani, that we are reaching people and we are leaving no one behind in our journey towards UHC. And Madam PS, this is an increase from mid-March, just 2 weeks ago when we started tracking this activity of CHPs. We just had 26,305 CHPs who are active. That is just about 2 weeks ago, or maybe 2.5 weeks ago. But today, 2 weeks later, we are talking about 42,000 active CHPs. This is very commendable, and I want to really appreciate all the CHPs for this activity. As I've said, we've also been able to serve 989,000 individual people. These are unique people, not just the forms you submitted, but the individual people who you gave messages, you provided information, you referred them for different services to the primary healthcare facilities. So we really want to appreciate you, and we know that we shall continue to see the impact of this program if we move in this manner. However, we note that last week we had 70,000 inactive CHPs. So again, we need to encourage our colleagues who are not in this call, who did not visit any household, and I'll be highlighting the top counties where this inactivity, where CHPs did not go to see any household members, and therefore those people who are under your care did not receive the critical health information that probably you got from this from last week's assembly, and they were not able to be screened for hypertension or diabetes. So that's a loss for now. As I said in the last week assembly, we expect that we have 100,000 active CHPs on a weekly basis. So I commend the 42,000, but then we also add the 70,000 who did not do any job to continue to do the work. So Madam PS, again, as has been the tradition, we have divided the performance based on the number of households that CHPs have been assigned to and have registered. So we have taken the proportions, and that will help us to come up with the number. So under the households band of people who have less than 50 households assigned to them, these are mostly, they're there across all the counties, but most of these people are in the ASAL, vast areas of the country where it's not possible to serve so many people because of the distance between the homesteads, which is quite large. And so under here, we had, in this band, we had about 4,000 active CHPs, which represent 14%. Under the band of people who have registered or who have been assigned between 50 to 100 households, we had 42,000, we had 17,000 out of 42,000 active CHPs. So 39% in this band were active. In the third band of CHPs who have between 101 to 150, we had 18,000 out of 34,000 active CHPs. That is 52% in this band were active. So they have many households, but then activity in this was also a lot. And this is where majority of our CHPs fall. And then for those who have been assigned more than 150 households, we had about 2,000 out of 5,000 CHPs that were active. That is 50%. So in the first, those who had less than, we also have the top 5 performing community health units last week. We have the first one is Turkana County. They have a few called Puch Community Health Unit. They have 11 active CHPs. In that community unit, they have 1,537 registered people or the population in that area. They were able to serve 703 people. That is a coverage of 45.7% just in last week. Then number 2 is Homa Bay County, Nyalenda West Community Health Unit. They have 12 active CHPs. They have registered 4,950 people in that community health unit. They were able to serve 2,238, that is 45%. So, and then the number 3, I'll just say the top 3. The number 3 is Wajir, in Wajir County. It is called Sarif Community Health Unit. They have 9 active CHPs. They have 2,000 population in that unit. They were able to serve 817 last week, and that is 40%. So then again, now we come to our top CHPs, and the band of who have less than 50, this is where we have our top CHP, who was able to see, who has registered 31 households. In those households, they have 136 persons. They were able to serve 135. So they almost serve everybody in their area. That is 99%, and that is the person we shall be giving the award to today. But I'll just like to read number 2 and number 3. Number 2 is from Wajir County. Their name is Mohammed Nur Ibrahim from Sarif Community Health Unit. They were able to, they have a total of 210 people within their area. They were able to serve 202, and that is a 96.2% coverage. Number 3, we have Ibrahim Mohammed Ali from Sukela Buki Community Health Unit in Mandera. They have registered 245 people. They served 230 people last week. So they are really super active in these areas, and that is 93%, and that is our number 3. Before I hand it over to our PS, I'd like to just highlight that we had 70,000 in active CHPs last week. So we had a whole week where 70,000 CHPs did not visit. They have registered households, but they did not visit any person in those households. And so the top counties with inactivity, we start off with Nairobi County. They have a total of 7,860. We had 3,974 CHPs in Nairobi who did not visit any household, and that is 50% inactive. Then Kakamega, we have 4,359. We had 2,872 inactive, and that 65% of the people did not visit anybody. So only 35% were working in Kakamega. And then the bottom, the third in that list is Meru. They were only able to see, they had 2,646 inactive CHPs, 71% were inactive. And then the really last one who had the fewest active CHP is Uasin Gishu County. Out of the 2,000 CHPs that they have, only 190 were active last week. So 1,878 were inactive. That is 90% of CHPs in Uasin Gishu County were inactive. I'll end there. I see we don't have much time. And Madam PS, we have been trying to look for Rosina so that she can be on this call. I don't know whether the coordinator was able to find her, but if not, I know that her community health assistant called John Palkeri may be on the call. So I want to hand over this to Madam PS to just give her remarks for the award of our first person that we are awarding, and also close the meeting for us. Thank you so much, and over to you, our PS.
Sorry, Maureen, I lost you a bit, but
yeah, we have finished, and I'm just giving you over this this opportunity so that you can award our number 1, our first CHP.
No, have you announced them?
our first, let me repeat again. So our CHP of the week, that is the week of 23rd to 29th March, is Rosina Ntayan Hase from Marsabit County, Lontolio Community Health Unit, who was able to serve 99% of the people in her village. She almost went to each and every person in the village where she's performing her community health work. So we really appreciate her. We've tried to look for her to join this call, but we couldn't be able to see her. But I think you can just talk about it. Then we have the second runners-up is from Mandera County, Ibrahim Mohammed Ali. It's from Wajir County, sorry, Mohammed Nur Ibrahim from Sarif Community Health Unit, who was able to see 96% of the household members. And number 3 is Ibrahim Mohammed Ali from Sukela Buki in Mandera County, who was able to see 93% of her household members.
Are they in the meeting?
We tried to look for the number 1, the CHP of the week. The chair and the community coordinator are still looking for her. I don't know whether she's been able to join. I'm just trying to get in touch.
And number 2?
Number 2 is from Wajir County. We have several people from Wajir here. Mohammed Nur Ibrahim. Is Mohammed Nur? I can see a hand. No, that is not Mohammed Nur. Do we have Mohammed Nur Ibrahim on the call? If you are here, you can just raise your hand. I can't see that hand. And number 3, Ibrahim Mohammed Ali. Ibrahim Mohammed Ali. I can see a hand has been raised. I don't know.
Yes, I am in charge of Ibrahim Mohammed Ali, Sukela Burki Mandera County based along Kenya border, Ethiopia.
Okay, you are the community health assistant in that area? Look, Mohammed, are you the chair in that area?
In charge of Sukela Burki.
Okay, Asante. So we have number 3, the chair who supervises Ibrahim Mohammed is here. Over to you, madam.
Now, if they are not in, you see, we can only congratulate them and clap for them. So maybe we can congratulate to Rosie. Rose who? Rosina. Did you say Rosina? Yeah, Rosina Ntian from Hase area in Marsabit County. Congratulations. Ibrahim Mohammed from Ali area, Mandera County, Sukela Buki Community Health Unit. Congratulations. We congratulate the winners of this week's CHP of the week, and I am sure we are going to continue with the same next week. I want to encourage you that we make sure that the winners are in the meeting so that they can testify and say that it is a true copy, that they got recognized. And also the CHU unit, the CHU and their coordinators should also be in the meeting. This week's highlight is I'm very happy that we have been able to move 3.3% of the CHPs who are active. Mimi niliwaambia ya kwamba nyinyi ndio nguzo za community. Nyinyi ndio nguzo za jamii. Mtoto akipatwa na joto usiku, unaletewa upime. Mama akipatwa na uchungu kidogo, unampima blood pressure. unampima sukari. Sasa tusikae na zile vifaa zetu na hatuzitumii kabisa. Wacha tuanze kuenda kwa manyumba, hata Mungu mwenyewe atakubariki. Utabarikiwa kwenye uko. Hata kama uko Mandera, uko Lamu, uko kona ya Kwale, kule Kisumu, Turkana, ama hata kule Central Kenya. Fanya kazi ya Mungu na tufanye kazi ya kusaidia wananchi. We would want to see ourselves at 70% coverage. And this is possible. Hii inawezekana kabisa, kabisa, kabisa. Congratulations to the winners. Congratulations to the CHP of the week. And we shall be giving more reports next week. Over to you, Maureen, and thank you very much. Asanteni sana. Tulisema masaa ni 5 to 6. Sasa tumepitisha na dakika 4. Sasa lazima nirudishe kipaza sauti kwa Dr. Maureen Kimani. Asante.
Thank you so much. Makofi kwa PS. Let us do e-clap, show her some love. She has stayed through the hour for this. You can see how important this is to her. I want to thank all the 500 plus participants who attended this meeting this week. I congratulate Rosina Ntaya Hase. We shall make sure we get your picture. We put you on the CHP channel so that you can be an encouragement to the other CHPs. Asanteni sana, Mungu awabariki, and we've come to the end of the meeting. Have a lovely evening. Bye, everybody.
Bye-bye. Thank you.